I'm Ned Jenny, licensed psychologist, founder and CEO of Edward Jenny and Associates in West Grove, Pennsylvania. I'm here again with my dog Maya in the corner there. And I want to continue talking to you about some of the things that can mimic ADHD and make the diagnosis of ADHD and assessment a little bit more complicated. So let me start off with a scenario here. Let's say you're the kind of person who's tried every ADHD productivity strategy that you find on the web. You've done the planners, you've done the timers, you've even had accountability partners try to encourage you to stay on track and give you prompts and check in on you. But it doesn't matter. Like whatever you do, it doesn't matter. It doesn't lead to an outcome that helps. In fact, the more you try to push yourself to be productive, the harder it is and the worse the problem gets. Well, there is a reason for this, and there's a name for it. Pathological or pervasive demand avoidance is something that was identified back in the 80s by Dr. Elizabeth Newsom. It's often associated with autism spectrum disorders, but it does also exist independently. So I want to point out that a lot of times these diagnostic categories coexist. So one person may have more than one diagnosable disorder. And that can really complicate the situation, but we have to think about all of these different factors when considering the best treatment for somebody. So what happens in PDA, or pathological demand avoidance, is that there's an extreme anxiety-driven need to resist demands. It's like the more somebody pushes you to do something, or the more you get reminded to do something, the less you want to do it, the more you want to push it away. And this happens because it's a challenge to your sense of autonomy, your sense that you're in charge of yourself and what you do. So the more that there are these external demands on you, the less it feels comfortable, and the more that you want to push back in order to really guard your sense of self and your decision making. The thing is, this is not being willful or being lazy. It's really your nervous system trying to look out for you and trying to keep you in charge, to guard your autonomy, which is really important to us. It's often, as I said, associated with autism spectrum disorders, but it's also often confused with ADHD, and it can co-occur with both of them. So what happens is, in the brain, the demand that it perceives is seen as a threat to autonomy and safety. You don't feel like you're in charge of your own life, and you don't feel safe as a result of that. So this triggers the nervous system into fight, flight, or freeze. That's the nervous system's response to danger. It's an ancient evolutionary pattern that's designed to keep us safe and to help us survive when we're under attack. So it's a threat. The problem is, the more pressure that's applied, the more resistance comes up to push against it. It's the opposite of increasing productivity because it's increasing the threat demand. So even enjoyable things can become really unpleasant if they feel like an obligation, if they feel like someone is demanding this of you and taking your autonomy away, then you resist and you push back. So this is something that leads to the person who can do something they refuse to do at the moment that it becomes something that they decide they want to do, rather than something that is being compelled from the outside. Because that's not a threat to autonomy then. It's something that they're choosing to do. So on the surface, this looks like ADHD because it seems to involve things like task avoidance, inconsistency, and difficulty with routines, but it's for a totally different reason. So with PDA, resistance escalates with pressure. With ADHD, avoidance is more about initiation and lack of interest. So it's tied to the nature of the task, not how it's demanded or not. PDA often involves a social strategy, so negotiating, distracting, avoiding through interacting with people socially. People with PDA often mask. That means that they are able to present themselves on the surface as having everything together, and yet that takes a great deal of energy in order to kind of fake it. And so they get really exhausted. So the things that we do for ADHD fail for people with PDA because structured routines increase the demand. And so they get more pushback. And accountability systems where like a partner maybe tries to keep them on track and gives reminders and encouragements, that can feel really coercive. And again, that attacks a person's sense of autonomy and they're going to push back more against it. PDA people typically have pretty good social awareness, whereas ADHD folks kind of can often have social skill deficits because they've been impulsive and because they've struggled with this for a long time. So the bottom line here is that you may test positive on a screener for ADHD, and you may actually have symptoms that look like ADHD. What we do at Edward Jenny and Associates is peel the layers back and find out why those symptoms are present and what to do about them. If you're ready to figure this out and get a good treatment plan started, give us a call. Thanks.